House Bill 1044 by Representatives English and Joseph concerning measures to improve equity in maternal health.
Representative English.
The committee report? I want to move the committee report. Okay, I move House Bill 1044 in the committee report.
To the committee report. Rep. English.
Thank you, Madam Chair. We have an amendment.
Rep. Joseph.
Yes.
Yeah.
Yes. In the committee, we've made several amendments for, based on stakeholding. We removed language or added language to help clean up around the CMEs for continuing education and the continuing education board. We also cleaned up the language around the rights of birthing parents in hospitals, and we had stricken the language around enforcement because it had a $2 million fiscal note, and we also clarified language around the maternal health task force or survey. And we ask for a yes vote on the committee report, but before we head there, we have an amendment which is L006.
Please move the amendment. Rep. English.
I move Amendment L006 to House Bill 1044 and ask that it be displayed.
Is properly displayed. Rep. English.
Thank you, Madam Chair. This is just an amendment to strike the date that it was going to initially start to give CDPHE the time that they need to make sure it's implementable and to make sure they have the proper sampling for the report to even happen. And we ask for your yes vote.
The motion on the floor is the passage of Amendment L006. All in favor say aye.
Aye.
All opposed, nay. Amendment L006 is passed. To the committee report.
To the bill.
Any further discussion?
On the committee report. Committee report or bill? Okay.
Representative Luck.
Thank you, Madam Chair. I just want to, I'm sorry, guys, coming up to speed, want to make sure, because the title of this bill references, well, in any case, I just want to make sure that birthing parent and birthing parent's companion, it applies to anyone, any woman who's having a baby at any hospital in Colorado. Am I reading that right?
Rep. English.
Thank you for the question, Rep. Luck. Yes, it applies to all birthing mothers in the state of Colorado.
Any further discussion on the committee report? Seeing none, the question before us is the passage of the committee report. All in favor say aye.
Aye.
Opposed, no. The committee report is passed. To the bill. Rep. Joseph.
Thank you, Madam Chair. We ask for a yes vote on House Bill 26-1044. Black women have a far higher likelihood of death during childhood than white women due to a systemic undereducation of doctors. It is the responsibility of this body to take action to remedy this, requiring obstetricians and other maternal providers to engage in cultural competence can prevent deaths caused by neglect. And also the bill requires a physician or nurse's aide whose primary practice in the area of obstetrics to complete at least one continuing education credit hours. We're actually asking the CME board to engage in stakeholding process in order to ensure there is cultural competence and equity in their training. And also, we're requiring hospitals, again, to ensure that they provide a statement of birthing parents' rights, because we know when people are better informed, that protects their rights and promote their rights as well. We ask for a yes bill on this particular bill because we know it's important to Black and brown women and birthing people all over the state to be protected in childbirth.
Is there any further discussion? Rep. Luck?
Thank you, Madam Chair. I just wanted to note the section that was added in committee related to the statement of rights of birthing parents. I am, as someone who has given birth in a hospital here in Colorado, I am grateful for these provisions and just restatements of what should be the norm. I did want to ask, I should have asked this when we were on the committee report, but when it says a birthing companion here and a family member, is that defined somewhere? Is that a doula? Is that a midwife? What is that we are saying they have the right to?
Rep. Joseph?
Thank you, Madam Chair. I don't have the specific response to your question, but I know that's currently actually the law, or community members are allowed to have a doula while they give in birth. So we're just ensuring that they have the notice. Thank you.
Rep. English?
Thank you, Madam Chair. Yes, that is absolutely correct. And we ran a bill in, I think it was 2023, about doulas. So we just want to make sure that it's clearly defined in law that you have someone in there to be able to support you through your birth, and that can actually help you get the care that you need when you're going through birth. I think that's all outlined in the bill as well, too. I see you.